it kind of hides everything. But you know that you can't style it because
I didn't. I was just
spreading it, left it.
Yeah, no, I was just shaving it,
Yes.
and afterwards this is
Now
I can't do
the top
anything.
view.
Yeah.
So if we compare this with the now top view, it will be totally different case.
Yeah.
Now this was the crown area,
Yeah.
which we obviously wanted to fill. Now see this portion. So when these hair grow, you will find all this filled.
Yeah.
And this won't be visible. So from the front, if we take a look, though sometimes appearance is deceptive, because these hair are there and they just spread out and cover up everything. But now, when we have done this, actually we have hair in that portion. So I'll show you how we placed it and how we planned it.
Yeah.
So yeah. So this was your donor. She shaved off. Okay, and this was your hairline, proposed hairline.
I really can't tell that's what, because that looks a lot for me.
Yes.
But when I look at it now,
That's why I was telling you that we can go a little lower.
yeah.
Otherwise, you were just insisting this much.
Yeah, I know. But I can't imagine that this is what you did.
Yeah.
This is.
And another thing, you remember I told you that this is very important.
Yes.
And you were like,
no, I didn't want to do it.
No.
Yeah.
No. But I think this has made a big difference, though it is a very subtle work, but it has made a huge difference on hairline. What do you feel now about the temples?
Great.
Looks
because
good.
I took pictures of myself.
Yeah.
And you see the contrast.
Yes.
And yes, you're right. 100%.
I'll show you now the pics. Yes. So that's how it was done on that day, surgery day. You can see. So these portions over here were most deficient portions. Now the frontal hairline also, I have worked this portion over here.
Yeah.
Okay. Because this will give you, now if you keep long hair, it's up to you. If you keep very short hair, nobody can say that you have got a transplant done. People will just say like, he has shaved off his head. What do you think? Did you send your pictures to your friends, family?
Not now.
These pictures.
Only two.
Two?
Yes.
Okay. What did they say?
Amazing.
Good.
I mean, they can't even say. I sent a picture today, and my brother he can't say. He said, "Yeah, you did something here on the top," because the scabs were there. But this part they can't say.
Yeah.
They
now
can't
the
even
scabs
say.
are also gone.
Yeah. So if I take picture, I took today and I sent it today, and they couldn't say.
Yeah, that's good.
They couldn't, and I can't say either.
Yeah.
I really, when I took pictures of myself and then tried to, it's, where did you put the hair?
See,
wasn't it always like this?
And
this I can't, that as well, you can't really see.
Yes. So that's the beauty of the procedure actually. It has been merged very nicely, That's the donor on the day, and this is the crown which I did. See? So crown was quite empty. So we have done this. This portion you had good hair, so just dispersed some hair in that portion.
Yeah, sure.
And these two were the most deficient sides, more on the left side. So I focused more on the left side. And that's how. And when you came last time, I think, that day, when we removed see. Yeah. This was the next day, and you did not take any antibiotic.
No.
Yeah, that's great. Without any and did you feel any pain or something?
Nothing. No.
Post procedure, nothing.
No.
So second day it was all kind of already healed. Yeah. See how beautiful it looks.
Yeah.
And the best part of the transplant procedure, when it is done nicely, it will keep looking very, very natural throughout the journey. Now the first day, second day, and even now, and during the shedding phase also, you won't notice anything abnormal in that, See how beautiful this.
Yeah, it's merged very, very well with the other hair.
It's healing, and that's your crown. And now we see the current pictures. If we see beautiful whirl pattern, I'll just click and show you.
Yeah, sure. This is amazing.
So that's it. So see this portion. we have worked.
It's a lot.
Yeah,
It's a lot.
It's a lot.
And you can't tell. I mean, I can't tell now. It's
now the best part of this, Adam, is suppose now if I have done this work and as these hair grow long, we'll love it. It will look great.
Yeah,
like mine.
Yeah.
But suppose if I add finasteride into this, you cannot even imagine what will happen. It would be a blast, you know. I mean, you can say almost 5 times, 4 to 5 times thicker and softer. So that's why we were discussing that day also. You told me that you went to many places like Turkey, Germany, and other Sweden.
Yeah, they say that they will do the work and they show pictures and they explain the procedure and the importance of medication after the procedure. So that was actually one of the things that they said was very important. And I didn't want to take antibiotics, and I don't want to take finasteride, and I don't want to take minoxidil because it doesn't attract me.
Yeah.
And I guess that's why I ended up here as well, because it's you don't support the.
See, I'm not against it, but I advocate, you know, a judicial use of that. I mean, which can be justified. So I don't use it as a blanket treatment for all my patients. You are 40, okay? I am 45. So we have seen some age, and now the hair loss is not that rampant, which is suppose the same rate of baldness. Had your age been say 20 years, in that situation, I would have thought of giving you some or the other medicine because I know the hair loss is progressive and I need to stop it. And if I don't stop it, I end up doing another transplant very soon and another transplant very soon. As long as we know that our expectations are realistic, as long as we know we can keep a high hairline and sustain. Sometimes people are obsessed with very low hairlines. They want, okay, doctor, you bring my hairline like this. And what people do, it's the surgeon's job, you know, to let them understand this. Because as a patient, if somebody is searching with a frequency of lack, because I badly need hair, doctor, just get me hair. Sometimes people are so fanatic about this, you know, they just want hair. They just want hair at any cost.
Desperate.
But the problem is, in that situation, they end up at places where they actually should not go, and if they the driving force is fear of maybe fear of rejection from somebody. If I don't have hair, somebody will reject me or that. So they will end up in a scary place. And the scary place is where you are pushed unnecessary medicines because it's not only patient who is who's scared. The doctor is also scared. Scared of what? Scared of getting a bad name to his reputation. Because if doctor is doing some work, it should look excellent and great. It may come at the cost of patient's interests, but it doesn't matter. But the thing is, any good doctor will put himself at the patient's place and think, okay, now had I been there, what would I have done? Suppose if I start taking finasteride now, my hair transplant growth, which you are seeing, it will look double, triple thick, you know, and very soft new hair will come. I will attract more and more patients from everywhere. But the thing is, it's not about selling. It is about the person who is sitting in front of me, who is giving his head, his emotions in my hands, and it's my job to plan it, to mentor the journey. As I always say, hair transplantation is a journey, not a destination. So we have to plan it. Okay, so that's why I did this. So I really love those patients who understand this and respect this what we have, because it takes extra effort to do all this as compared to giving blanket treatment and get good words. Okay, get appreciation, but that's like free appreciation, not my work. This is purely my work. I know. Yeah. So I know I'm not taking help of finasteride. And see, in case somebody is losing hair, there is thinning, I can add later on at low doses. But that will rob of me the photo opportunity shoot. That's it.
Yeah.
But it will be good for my patient because my say out of 100, no one would like to take the medicine if he's actually told all the limitations of the medicines. But most of the times the limitations are underplayed and it is given very casually. Oh, you take this and oh, this is necessary. So if these medicines are given after brainwashing the patient, that's not good. That's what I'm against.
Yeah.
But I do prescribe this medicine to my patients, but not everyone. And not at high doses.
And in my case?
We did not even start minoxidil in your case. So, because you are 40 and there is no very rapid progression of disease.
No.
So, if there is not a very rapid progression of disease, we don't need it. Later on, suppose you will be doing derma roller, you will be using, taking a good diet. Anyway, you are such a religious and spiritual person who takes care of himself. That's great.
Yeah.
So, in case we are able to maintain on that, as long as we'll maintain. In case we feel that okay, now we can see some thinning getting there, we can add minoxidil maybe later on.
Exactly.
Anytime.
Yes.
But at least I should give your body a chance, to heal itself at its own. And I've extended it up till here. So obviously hair loss can be progressive. I've covered this. I've merged with this. I've gone like down, little down, up till here. Not only here, little more. So I've covered this entire portion. Okay. So in case there is further thinning, then maybe we will add. Otherwise, there is no need.
Okay.
So yeah.
Because it's like here you see that
You
such
will
a big
find,
difference
yes,
between
this
here
hair
and here.
This hair, yes. So, but this is this zone which seems pretty much covered.
Yeah.
Okay,
But
so
I can't really get it why it's so.
Yeah, once you shave off only, then you will see that this is thinner. Yes. So the same density is not all around.
Exactly.
As you go towards this, these were even more thin, as we can see over here.
Yes.
So as we go down here, even then they are thin, like over here.
Yeah.
So that's the grading. So even the transplanted area also, we have done more hair in this zone. Okay, the frontal zone, this portion. If you see over there.
Yeah.
So if we see this portion, and especially the temples. So now this is my gift to you because
Thank you.
this one you were not really keen, but I was so keen. I knew how it's gonna look.
Yeah.
So it looks very beautiful. Head down, please. And this entire portion, other side, please. Here also we can see very beautiful growth and the temple. Now the best part, crown, turn around, please. Turn around. Now this is 13 days post-op. Yeah, so we can take a look over here. The crown part is so nice and even the top portion is so nice. Now these are the areas where we can see relatively thinner hair, because now this area looks relatively thinner because we have thicker transplanted hair near it. Okay, otherwise this was relatively better. So we have made the weaker little stronger now, I guess. And head down, please. So this is like unsafe donor zone which we did not touch. So where you see thinner hair, okay, thicker hair only, that zone we have used. And even this zone, it looks great, and it has healed now. No pain, nothing.
Nothing. No.
Very good, great. Turn around, please. So now you can have a look and see.
Yeah, I mean, you can really see that there is a hair transplant done, right?
And especially take a look at this. There you don't see any artificial triangle being made there.
No.
We have used very soft hair.
Yes, and also
Irregular, zigzag.
yes, because I was so afraid that I would get like a straight line like this. I said
like a stencil.
Yes, I've seen photo pictures and videos where people they just straight line like this.
Yeah.
And then it goes like this, and then down like this. Yeah. And I knew that you would not give it to me, but I wanted to be sure. So I told you, unregular, please. Natural. And that's really what it is, right? it's an artwork for sure.
And the angles which we have followed, actually, these are your own natural angles, which
Yeah.
would have been.
Yeah,
there.
it's
So that's
something.
why I would say that.
It's this like it's not a big difference. It's like I recognize myself.
Yes.
So it's like
I do.
traveling back in time.
Yeah, so do send your pictures, keep sharing the
Sure.
pictures.
Yeah, sure.
Okay.
Yeah,
So-
I would like to, to share.
Yeah.
It's your work and it's
Because we really need to see and
yeah.
be
I'm
happy.
gonna and every time I come to India,
Do visit us.
Yeah, sure.
Sure.
Yeah,
Okay.
yeah.
And when I come to Sweden, I'll
Yeah,
make sure
yeah.
that we meet.
Yeah, exactly.
Thank you so much.
Yeah, thank you very much.
Thank you so much.
Yes.
Thank you.